Welcome to Celebrity Interviews with Paul. I have with me Trini Matthew. Trini is a member of Lutheran Church of the Master. You may know her from singing in the choir, but she also has a day job. Trini is an infectious disease doctor at a local hospital, and so we have the opportunity to learn a little bit more about COVID-19 because we all care about infectious disease all of a sudden. So welcome, Dr. Matthew.
Thank you very much.
Great having you here. Now, I know you've got a lot on your plate, not just at work, but at home. You have both your elderly parents live with you. They've got medical complications that you get to deal with. How's life in the pandemic with all this, with everything going on?
Yeah, it's a lot of juggling, definitely, and a lot of being mindful of what I'm doing, and especially working and juggling and going outside, doing grocery shopping and all the other things that we have to do as part of day-to-day living. And by keeping in mind that I have to be cautious, because I know at work what my exposures are, but at other public places, I have to be cautious that I'm not exposed, because I don't want to bring it, definitely not infect myself, but of course, because my parents are at home with me, I have to be very careful that I don't create any problems for them, and then also for the home health aide who I have. So as in some respects, responsibility to many people, not just from work perspective, but from, home and what we have to be careful about. Yeah. So it's been interesting being very mindful of how long I am outside and how frequently have I to go grocery shopping. Yeah.
Yeah, it's a challenge. Well, I have a confession. I made this confession publicly on when you were joined our synod rostered leaders, the pastors with the bishop, and that is that back in March, I had a conversation with you at one point as we were getting ready to have what turned out to be our last Lenten supper for 2020, and you made a comment about making sure that you keep people keep 6 feet apart from one another and things like that. And you didn't. I don't think you saw me roll my eyes, but I did, because I was like, "That's crazy, 6 feet apart. What's all this stuff?" And here we are, not only staying 6 feet apart, but wearing masks when we go out in public and all those kind of things. So as we talk about COVID-19, so my confession is I am sorry, you were right, I was wrong. And it's kind of, to me, it's also an example of how quickly the world has changed and shifted for us all as we try and adapt. So when we talk about COVID-19, why is this disease so dangerous? How is it different from other kinds of diseases? Why all the shutdowns?
And I agree that, hindsight is 2020. And in fact, not just yourself, I was thinking early on in January, yes, we have to be prepared, but I would have never thought that we would have to go to the extent of universal masking. Clearly that was being done already in many of the Asian countries, even way before, from the first time that they had with the SARS and other pandemics or outbreaks they've had. They're very comfortable as a community to wear face masks outside their homes, and especially when they're traveling. But even thinking that we would have to do it, it would be an order and things to do here. In the back of my mind, I was thinking that we will never end up doing things like that, because I thought we would be better controlling our outbreaks. But clearly that did not happen, as the numbers have clearly told us. We're more than 2 million cases here, right? And so that's what's humbling. That's what we have to understand, that unfortunately with infectious disease and with microbiology, our goal here is always to try and anticipate and just stay 1 to 2 steps ahead of a novel pathogen or existing pathogen. And it's very humbling for that reason, because we kind of anticipate, we kind of think about the models or how it should be from the past experiences, but clearly none of us were prepared. And that's what it just shows, how the world globally, how we are all closely woven together, internet, and are connected with each other, and how even us in the US, we were not ready for what was to come. And if you look back and think back and we reflect on it, so again, it's a good opportunity for us to think about how a lot of what we did, we would have never thought we would have done it, and how humbling it is for thinking that as a country, as a nation, where we should have really been foremost in everything. How, yeah, clearly we are in the number of cases we have, unfortunately, but we honestly, now hindsight 2020, but now we have to work better to help everyone out in the future, knowing what we know about this pathogen And going back to your point about the pathogen, what's interesting is how much we are learning about it, and how sometimes in science, in our eagerness to get the message out, we might be giving conflicting messages to people.
Right.
So very frustrating for the public. Sometimes think, oh, we don't think it's spread unless people are symptomatic. But then we always like, oh, but actually there can be models, and we know of other infections that can spread asymptomatically. Take your influenza, and inquire people know in the flu season, I do not shake hands in my effort to kind of prevent at least accidentally transmitting by my hand. So I don't do that when we're passing the peace, the sign of peace. We know that.
I don't think we're going to be shaking hands ever again at this point.
Yeah, I know. It's going to be a taking
and yet at the same time, we're learning, as I read and stuff, it sounds like we're learning that there is less transmission on surfaces. And
well, that's what we're learning now again, but that doesn't mean that we would want to kind of keep touching surfaces and not wash our hands before touching ourselves.
Probably wouldn't want to run your hand down a rail in a public building and lick your hand afterwards.
Correct. That's a good way of putting it. But and also not be anxious about everything. Like, oh, I touched something, and how frequently do I wash my hands? And then I touch something else. So being in some respect cognizant, but knowing that science in some respects is not absolute. As we're learning from this pandemic, we are discovering everything new thing.
So now we're in this kind of level of risk assessment, right? We assess our own health risks, and then we assess the risks of places around us. And there was an article in one of the local papers. They talked to a bunch of doctors that talked about ranking different places on a scale of 1 to 10 is how dangerous. Airplanes, they only put it like a 4, I guess, with the HEPA filters and things like that. They said that was their assessment in general. Bars, apparently a lot of people, a crowded place with alcohol, not a good combination for responsible behavior, which is shocking information to most of us. That was like a 9 out of 10. But what was kind of humbling as a pastor is they rated churches at an 8 out of 10. And one of the quotes there said, if they're singing, it's a 9 out of 10. So why would going to church be as dangerous as going to a bar?
Yes, that's a good analogy that you bring up. Apart from the wine, I think that's the similarity there, right?
Only a little bit of wine.
A little bit of wine, yeah. But that's funny that you bring that analogy. But the point is, in some respects, a lot of medicine, what I relate to is people, places, and things. So people. So if you look at that, people, places, and things, people, we are a lot of us together, even though it's a short period of time, in church, some churches compared to bars, people may spend a lot of hours compared to some churches where a couple of hours, like Lutheran for us.
Right.
But places, again, you're talking about the environment, the ventilation. Now, of course, the best way to do is outside. And again, because there's free air flow, and what we're talking about, diluting of contamination in the environment of the air supply. And that's where they talk about, if you have an air exchange through a filter, you might decrease the suspended particles of the virions of particles that's there of any pathogen. So that decreases it. So again, the closer we are proximity, and if I am close with someone and I'm speaking a whisper, maybe I might not be bringing out those particles, but if I speak loudly, if I shout, and of course, if we sing, and all you need is a one strong person bringing it all out. And we have had studies. That's the thing, interestingly, the outbreak that happened, one of the outbreaks in Washington State, associated with a group of people singing, and how many then subsequently came down with an infection. And that's known to occur from the world of tuberculosis. We know that very well. Things that stay suspended in the air for a while can potentially infect others when people are around together as a group. So those are some of the things we know about. It's just that we proved it also it occurs with COVID-19.
And so that's why, and that's I guess also why then as we begin worship in person, when that day comes, we're not going to be singing, because singing expels those aerosols into the mouth, into the air. But what if we wear a mask?
So if you wear a mask, of course, if it's complete, very tight around the face, then less chance of the particles coming out. But how hard it is to wear a mask is something everyone should try out in their homes and stay on with masks for a period of time. So for example, now at work, we always are wearing a mask, and it's very hard to speak through a mask, and for people to understand us, but also for ourselves, And it's not easy for everyone to wear a mask. So you will end up taking off the mask. And especially
Mhm.
when you're singing, the air is being propelled out, but you're trying to breathe. Your nose is covered, your mouth is covered. So it will be very hard for people to hold on to their mask appropriately. And most likely they might start putting under the chin. So we start singing, that's when there is going to be a possibility of people spreading it because a mask is not covering well.
And so you're talking about like an N95 sealed mask. So I would probably have to shave my beard, and it would be, it would be, as opposed to like, I have my cloth
Regular,
mask that Penny
yeah,
Paul gave to me. Um, this might help some stuff, but I'm guess it's
yeah,
not exactly sealed, and stuff can come out the sides and all that kind
yes.
of stuff too.
Yes, yes. And so that's the thing. I think we have to be cognizant that it's not just ourselves we're protecting, we're talking about protecting those around us. And it
Right.
could be a couple of pews ahead of us, a couple of pews behind us. So we just have to be aware about that.
It seems to me one of the blessings of church is that we have this diverse group of people that get together, and people who in regular walks of life wouldn't meet each other, wouldn't
Yes.
cross paths necessarily. And it's a beautiful thing that we get engineers, and we get doctors, and we get teachers, and we get nurses, and we get all these people from all these different backgrounds, and investment people, and all these different groups. They come together, and that's a beautiful thing with all those gifts at the church. And in the situation where you've got a novel pathogen like COVID-19, that also means that they bring that diversity of encounters with them into the church, which is that's part of it. It seems to me that's part of what creates the liability at a church, because you have all these different people from different places bringing, who wouldn't necessarily be together otherwise, but they come together. And then add that to the fact that we tend to like to touch each other, and people hug each other, and we sit close to each other, and then we sing. I mean, all those things, I guess, are part of what combines to make that such a risk.
And you're right, especially if people have not seen each other. It's like, oh, old friends. The first inclination is towards, hugging and saying, oh
Right.
wow, so glad to see you. You're healthy.
Right.
I'm glad to see you. So that inclination, that's our human nature, and which is true to be close to each other. But it's going to be very awkward now if someone comes to hug you. You're like, oh, wait a minute. So I think we have to be honest about that aspect. But I think first maybe everyone should try and see if they can even wear a mask for at least for an hour and a half, and
Yeah.
just sing through it, talk through it, and see what a challenge it can be. And so, let alone if you're a healthy person, let alone if you are already having problems with your heart or your lungs, how
Right.
hard it is to breathe through with the mask. So I think it's unfair to tell people you have to wear a mask because some people cannot, and they would like to be in church, which is true. It's
Mhm.
not fair to kind of say some of you can come and some of you cannot. So I mean, I think there's a lot of things, a lot of variables to consider when we talk about having people together in church.
Sure, sure. Well, part of what we're waiting for is guidance from the governor too. And when Governor Whitmer sees that statewide and regionally, the numbers are such that they're comfortable, that we could do that. So what else do we need to know about COVID-19? What would be helpful as we talk about, as a congregation, as we talk about coming back together, or just even going out in our lives in the world?
I think the key important thing so far we know from science that has not been refuted clearly is washing hands saves lives.
Okay.
So that's a campaign that we've had in medical field. Washing hands, saves lives kind of thing. But that's literally true. And what I've been telling everyone, when physicians, literally it's in our hands, meaning
Mhm.
we have the control to try our best to protect ourselves and of course protect others too. So I think washing hands as much as possible, limiting being around lots of people at the same time. And even when we are out in parks, as people start coming close by, you have to be careful because I might be close enough or I might speak loudly that my air with contaminated particles might affect someone else.
Mhm.
And their mask might be slightly down and might
Mhm.
infect them. So I think those
Sure.
are things to be still aware about: how you're wearing a mask, how you're talking to people, being close to people, showing other ways of acknowledging them being present, and but not being in the very close proximity. And then the other piece for us to remember is staying healthy.
Mhm.
If the more we get stressed out about things, it is just going to increase our stress level to a point where our blood pressure, other things are impacted. So I
Right.
think that's critical piece. Now it's a beautiful weather for Michigan in some respects, trying to enjoy if you can, be outside enjoying that, but with reasonable measures in place so that you don't get infected and you don't infect anyone else at home. But at the same time, not stressing yourself about this. As much as possible, staying healthy, but exercise, sleep, that's important too for us. And then, sometimes understanding that science is not absolute, and so it is conflicting and very stressful for anyone in the public to say, oh, now they tell us this, then they come back and say, no, that was wrong, sorry, it is not what we said. So unfortunately, messages keep changing, and we do need to wait out some of those decisions that are made that are thoughtfully reviewed and kind of considering the risk and the benefits, and then wait out for those things. So in some respects, be patient still.
Well, I've heard some people say that, I mean, this is obviously we don't have a vaccine. We have some treatments, but we don't have like, if you get it, you take this pill and you get better kind of treatment, right? And so, what we've done is we've managed to stabilize it a little bit, at least in Michigan and around us, which is great. But in a sense, we're still where we were because we still have COVID-19 around us. And I've heard some people say that it's not so much if you're going to get COVID-19, but when. And if we're talking,
That's an interesting perspective. I really hope it's not when, but you're right. Some people, they let down their guard, and that's the point where, you might get infected because everyone is around and about. And for a minute, we are like, oh, well, let me just go in. And I forgot to, wear my mask. And lo and behold, someone beside me, it was coughing even with the mask and couldn't control it. So there it is. Lo and behold, I get infected. So, but I would really want to think and be optimistic that it's not going to be when, but it's more of, that we will control it. We will increase it as long as we are not having, different surges coming through.
yeah.
As long as we don't have like an uptick. There was always concern of, when the groups were gathering together on the protests that we were having.
Mm-hmm.
And fortunately, the uptick has not been very high. So far that we are seeing. So those are all good signs, but we wait out at least more than one incubation period to completely say, yes, from here, the outbreak is controlled.
Right. So like the numbers you see today are reflective of behaviors that were taking place 2 to 4 weeks ago.
Correct.
Is that right? So now we're seeing what we were doing in the middle to late May.
Correct. I mean, yeah, we say the incubation period is 2 to 14 days potentially.
Okay.
So 14 days is what we're looking at. And then, so if there's a small 1 or 2 people clusters of outbreaks happening, then you have to be careful. Are they spreading it to others? And then it's like a domino effect if it's happening. Right. And then that 14 days keeps on extending and extending. So that, but the numbers look promising in the sense that the curve, what we call, is on the downward slope. So that's what's important for us. As long as start doesn't go up, but we want to keep on coming down the numbers.
Somebody keeps calling. I'll just have to let it go to voicemail. We'll just ignore it for now. Well, thank you so much for your wisdom and for guidance and for your insight and for what you share. Do you have in the midst of all this stuff, everything that's going on, how do you find joy? Where do you see joy in your life these days?
The irony is singing, but not with a group of people.
Okay.
Sometimes, I mean, singing in the house, sometimes I'm just walking outside and suddenly a song comes to mind and then you sing, Okay. So I think whatever makes us be joyous, it's important for us to kind of keep going back to that. And I think that's what's important. I enjoy sunshine, so I like to see and be out there if I could, as work permits and time permits. So I think those are important things for all of us to keep in mind, balancing what we really like and being optimistic, being around people, chatting with people who are optimistic. You don't want to be always around someone, the Debbie Downer kind of people.
Right.
But it's hard because all of us have those moments of being down, and we all are, I mean, as humans, it's hard for us not to be down. But what can we do to become more optimistic and positive? And I think that's the hard part, but we can achieve it.
Yeah, yeah. Sing by yourself, solos in the
Yes,
car, in the shower, and on the
yes,
walk with the dogs. Sounds good.
yes, yes. And the dogs may join you too, so enjoy that.
Yeah, we'd probably be like note for note, I'm thinking, and nobody would be happy to hear it. That's for sure. But well,
Yes.
thank you, Trini. Thank you for your time
Thank you so much,
and for your
Matthew.
insights and for your wisdom and for sharing this day.
Thank you very much. Stay safe. Bye bye.